I'm here with Sherri Tetachuk, and tell me a little bit more about what Renalogic is and how it's impacting the industry.
Okay, great. So Renalogic is a company that specializes in chronic kidney disease care management and dialysis cost containment. And how we're a little different is we do contain the cost of dialysis because currently dialysis is costing plans about $85,000 a month. And the plans are responsible for that patient for 30 to 33 months. So where we really shine is we run data analysis on the plan's renal disease risk and identify those patients for them, from chronic kidney disease patients to all the comorbid conditions that directly affect how the kidneys function and filter.
Okay.
So some of those conditions that we're identifying, of course, are diabetes, obesity, congestive heart failure, high blood pressure, lupus, those types of things. All those comorbid conditions affect how the kidneys filter.
Okay. So just to get back to the basics, you're able to be right at the beginning of this before it starts in a patient. Is that right? And then what happens from there?
Okay, that's correct. So we're identifying these patients with the goal to delay or arrest the onset of ESRD, end-stage renal disease, dialysis. So that has many different benefits. The one that the plans are most interested in are saving that $85,000 a month. What we're most interested in is getting better patient outcomes because ultimately if you do that, then we're going to keep those patients out of the inpatient, out of the ER, cut down on doctor visits and that type of thing, and help them take responsibility for their own medical care and their livelihood.
Mm-hmm. And what is the process once you've identified this in a patient? What sets in motion the unique process of care or a different approach to seeing that patient?
Okay, so what we like to do is set a baseline for the employer and show them where their emerging risk is. But we also will identify the cost of those patients, and typically the patients compared to our baseline, and our baseline patients are going to be people that haven't had any kind of risk involved of developing chronic kidney disease. So we compare those and we show the employer what those current patients that we've identified as emerging risk for renal failure are costing the plan. And typically they're costing the plan anywhere from 5 to 68 times the amount of our baseline member. So they're already extremely expensive before they even hit dialysis. So once we engage those members, we first build a relationship with them. They are assigned a renal and diabetic nurse to work with them, because that's where you really have to specialize. We compile all of their information for them, all of their doctors, their medications, their comorbid conditions, and we put it together on a little fold up so that they can take it to their doctor. If they have not been tested for chronic kidney disease, but they have those comorbid conditions where we know through our information through the National Kidney Foundation that it's probably affecting their kidneys, we're going to give them a script of what to ask the doctor to test for. A lot of patients don't want to talk to their doctors about that, so if they don't, our nurses or our chief medical officer who's board certified in nephrology will get on the phone and do a peer-to-peer with the doctor's office. The doctors love this because typically at the primary care level they only have about 5 to 7 minutes, and so to try to keep track of their entire medical record, it's very difficult in one setting like that because they're often seeing cardiologists, internal medicine, primary care. Most of them have not seen nephrologists yet. In fact, about 80% of people whose kidneys fail have not seen a nephrologist, which is frightening. Mm-hmm. So what we do is we coordinate their care, help them understand what the doctor's saying, give them scripts to talk to the doctor, we'll talk to the doctor, and start getting them involved in their medical care. And as a result, what ends up happening is they're able to stay at work. The medical costs go down significantly, inpatient ER, and also we will identify, like, say somebody's getting a prescription for some kind of congestive heart failure. We will look at all those medications because oftentimes we've found that maybe the heart doctor is prescribing something that's damaging the kidney, but the patient hasn't been diagnosed with chronic kidney disease yet, so they don't know, because all the specialists are focusing on the diabetes or the congestive heart failure. They're not focusing on the entire picture that affects that kidney.
Right, right. Is that a unique approach?
It's
Getting
very-
a big, broad picture of an individual like that?
It's a very unique approach because, like I said, most people don't even know they have chronic kidney disease. So, and another really cool thing is when we get involved, and if we can stop them from going to dialysis, it really cuts down on the depression rate too, and it keeps those members happier. And then when they're happier and healthier, then they're at work more. So there's a lot of residual medical costs and costs to the employer that is ultimately going down just by focusing on that patient's health.
Okay, well, thank you so much for your time. Is there anything that I've missed?
I don't think so. I just wanted to say, so if they do go to dialysis, we have a very specialized program through amending the plan document for a savings of about 85% off of billed charges. So typically right now PPO networks are getting about 10 to 20% off billed charges, and our program can really impact the cost of dialysis as well. So we have kind of what you would like to call an end-to-end solution for renal care.
All right, Sherri, thank you. That was excellent. Thank you so much.
Thank you.